Come on in.
Hello, how are you?
Good, how are you?
I am fantastic. It's Dr. Crow, is that correct?
Yes, it is.
Dr. Crow, my name is Ernest.
Ernest,
Broomfield.
nice to meet you.
Nice to meet you as well. So just a little background on myself. By day, I'm a full-time sales representative with Amgen. By every other hour, I'm a proud fighting Texas Aggie. But tell me about yourself. I mean, seriously, beyond taking care of your patients and in reality, saving the world, what keeps you busy?
Well, this practice definitely keeps me busy. So
Sure.
I've been here for a couple months now. So getting used to the town, getting used to the patients.
Sure.
Yeah, there's a lot going on.
Yeah, absolutely. Last I spoke with Dr. Lovett, she mentioned that she was on her way out. I didn't realize it would be this soon, so
Yeah.
I'm incredibly happy to speak with you today. I mean, what's different though? I noticed you practiced over at UNT. Now you're here in College Station. How's the
Yeah.
adjustment been for you?
Well, I finished my residency there.
Got it.
And since I've been here, for the most part, I mean, when you do rounds, most of the patients are pretty similar.
Sure.
You have the same issues you have in Dallas as you do here, as you do in California or other states. So for the most part, I think we're dealing with pretty similar issues across
Makes
the board.
sense.
Yeah.
Makes sense. Well, as you mentioned, there's issues that we're dealing with at our fingertips, right? And so that's why I'm elated to kind of speak with you today to talk to you about Repatha and how it's proven to save lives, essentially. And so at the end of this conversation, hopefully you'll see the value in Repatha. But how much time is good for you today?
You know what? I just had a cancellation, so I have about 18, 20 minutes.
18 to 20 minutes? Okay, perfect. Well, to kind of keep me on track today, I've put together a very flexible agenda for us.
Okay.
So throughout this conversation, the way it'll be structured is first I'll ask you a few questions. I really want to understand about you, how the adjustment has been at your new practice here in College Station. Then I'll show you a little bit about Repatha and how it's been so successful in the past and why patients love it. Finally, if you see the value for your patients, I've brought some samples along. I'd love to get you started on them tonight. How does that agenda sound? Is there anything you'd like to change about it?
No, it sounds good. I mean, I'm a little familiar with Repatha.
Okay.
We dabbled in a little bit at UNT, but I haven't used it consistently enough, and
Okay.
I certainly haven't used it a lot here.
Okay.
Yeah.
So you mentioned that you've dabbled in it, and I'm sorry, if you see me looking down, I'm just going to be taking a few notes. You mentioned you've dabbled in Repatha. Tell me a little bit more about that.
Just patients that would come in that were already on Repatha therapy, I would just continue the therapy.
Oh, I see.
And I read a little bit about it when it first got approved, so I'm fairly familiar with it, but I understand there's new data
Okay.
on Repatha, so I'm interested in learning a little more about that.
Sure. Well, I'm happy to share as much information as I possibly can to help you really understand the product. But before we get too far, Dr. Crow, as far as it goes, making decisions for the practice, I mean, tell me about that decision-making process. Are you the only person to consider in this conversation?
Specifically about what?
About making
Excuse me. Amgen's competition is here. They need to see you for a second. You step up for a second, please.
Yeah, I'll be right back.
Sure. Take your time. I understand.
Sorry about that.
Hi, yeah, no worries. Do you need me to step out? Is everything
No,
okay?
we're okay.
Okay, perfect. Well, like we were just talking about, you mentioned, we were discussing the decision-making process. So if there aren't patients that are on the Repatha, I'm curious to know, are you the only person that would be deciding if Repatha is a great option? Is there other folks in the
No,
clinic?
absolutely. For my patients, I'm the primary decision maker for
Okay.
the therapy.
Awesome. And when we talk about making decisions for the therapy and for your patients, what's critically important, like, what do you think about when you think about onboarding the next breakthrough medicine?
Well, obviously the number one issue is, does the medication work?
Okay.
And is it relative to what we're trying to achieve in the practice? And most importantly, is it safe?
Does it work? Is it safe?
Yeah.
Makes sense.
And does it address the concerns that we have?
Does it address the concerns you have? Tell me more about those concerns. What are the concerns you're typically
Well,
seeing?
generally speaking, so
Okay.
whenever you have new medications, it could be new medications. For example, if it's a hepatitis cure medication like
Sure.
Sovaldi, well, I don't see a lot of hepatitis patients. So just because it's a new therapy doesn't mean it's relevant to my practice.
Makes total
Yeah.
sense. So tell me more about your practice and your patients then. I mean, what is the majority of your patients? What are the concerns that you're seeing?
Well, as a primary care clinic, we have a lot of, patients with sore throats to patients with nasopharyngitis. A lot of overwhelming majority of patients do have some underlying cardiometabolic disorders, so
Okay.
most of them do have elevated lipids, elevated glucose that we manage.
Makes sense. So speaking of these CV diseases and elevated lipids and high LDLs and all that fun stuff, how are you going about like treating that? What are you recommending for your patients today?
Yeah, well, I don't see a lot of new patients, so most of the patients have been part of the practice for years.
Okay.
So we evaluate their lipids, and most of them are on statin therapy. So we'll either, if they're at goal, we'll continue therapy. If they're not, we'll make slight modifications to their therapies.
Makes sense. And you said something, a goal. If they're at goal, you'll continue them on the statin. If they're not, you'll recommend other therapies.
Mhm.
Tell me more about that goal. What is the end goal for your patients?
Well, obviously we risk stratify based on their LDL numbers. So if the
Okay.
patients have had multiple comorbidities, diabetes, they're overweight, we'll try to push the LDLs as low as possible. Even though the guidelines are 70, that's our goal. We
Sure.
will try to get them below that. And the ones that don't achieve that number, we'll try to either increase the doses of statins, add other agents,
Sure.
such as Zetia and other medications.
Okay, got it. And you say, so if I'm hearing you correctly, some of your patients are seeing that threshold of below 70,
Mhm.
whereas others may not be seeing it, and you're recommending maybe a higher dose of statin or different therapies.
Sure.
How many of your patients are seeing that threshold fall below the 70?
I would say close to 70% of them.
70% are seeing it fall below the 70,
Yeah.
and the other 30% are not.
Yeah.
Do we know any reason why it's not falling below the threshold?
There's a lot of different reasons. Adherence is a big one. Side effects with medications force us to kind of back off of the dose of the statin a little bit. Some of them just haven't been on therapy long enough. Some of them just don't respond.
Makes sense. Makes total sense. So, how many patients are you seeing, average?
We've been seeing on average maybe 50 patients a week.
50 patients a week. Yeah, that's incredible. Good for you. And seriously, thank you for what you're doing for the patients. Well, Dr. Crow, really what it sounds like I'm hearing is you're seeing an average of 50 patients per week. A lot of your patients are coming in, well, they're already existing patients. You're not seeing a lot of new patients, but the patients you are working with have maybe a history with cardiovascular disease or maybe some type of strokes or something of that sort. Is that correct? Am I on the right track?
Yeah.
Okay. And what I'm also hearing is 70% of your patients are falling below that threshold of the LDL level at 70. You're finding this success because of the statin and other therapies such as working out, maintaining a healthy diet, things of that sort. The other 30% just are not responding the same.
Mhm.
What are you doing about the other 30% that aren't responding?
Well, like I mentioned, we'll either try new therapies
Okay.
or adjust the statin dose,
Got it.
or sometimes you just, that's the best you can do for those patients.
Makes
Some
sense.
do, as long as you have them on the highest tolerated statin dose, that's what we have to deal with.
Makes sense. Okay, got it. And I'm just going to take a quick note of that. And so for that 30%, because I am particularly concerned, what happens if diet doesn't help or more fitness or a higher dose? What's the concern there? What would happen if you didn't have a solution?
Well, obviously, there's a direct correlation between elevated lipids and cardiovascular outcomes. So
Absolutely.
if the patients have had are at high risk, then we certainly would entertain new medications. And I'm not opposed to using a product like Repatha.
Okay,
And in fact, some patients in the practice are on Repatha
got it.
that were previously prescribed before I got here.
Makes sense.
So they continue that therapy.
Okay. Okay, cool. Well, so overall, it sounds like you've got an incredible practice going on and you're seeing a lot of success for your patients. So kudos to you guys. You mentioned 3 goals for yourself when you're considering a new product. Does it work? Is it safe? And does it address your concerns? Well, I think first off, we understood that your concerns for your patients specifically are these ones with the CV disease that may have some sort of history. So I'm thrilled to tell you about a product that's going to work directly with these types of patients. The other 2 things you mentioned, is it safe and does it work? We've got studies to back it up and I'm excited to share that with you. So all that being said, I'm thrilled to kind of address those 3 points for you if you're up for it.
Yeah.
Does that sound okay with you? Perfect. Well, the first thing I want to mention is, does it work? Well, Repatha, Amgen, we conducted a study. It was a Fourier study where we tested 27,000 patients. Of these patients, they're very similar to your patients, all of which are on a statin. All of the patients that we put on the study have a pre-existing condition, may have had a heart attack or a stroke or something of the sort, and all of them were above that level of 70. So right now we're going to really talk about the 30% that aren't falling below the threshold. So when we put them on this study, what we found is in 4 weeks, their LDLs dropped tremendously. And you'll notice the blue line is the individuals who did not take the Repatha. The red line are the individuals that did take the Repatha. And I want to assure you that Repatha is a product that works in conjunction with your statin. So if you are already prescribing the statin, like you mentioned, it's extremely beneficial to add the Repatha. Does that make sense? Do you see how this is going to be valuable to your patients?
Yeah. So remind me again what the blue line represents?
Absolutely. So the blue line is what we considered our placebo patients. So they didn't in fact receive a
So they were on statin. Statin was the baseline.
That's correct.
Okay.
That's correct. Did that answer your question?
Yeah.
Do you have any other questions regarding that?
No.
Okay, makes sense. The other thing you mentioned is, oops, I'm sorry, let me look at my notes. Does it address your concerns? So I want to talk a little bit more about those concerns before I start telling you why all the great thing and why I'm so passionate about Repatha. Does it address your concerns? Well, we know that Repatha is going to reduce levels of LDL, as I just showed you. And I would love to show you this as well, just for reference. We can have it right here. But so we know that Repatha is going to reduce these levels of LDL, but in turn, what's the true consequence if these LDLs don't fall?
I mean, ultimately, it's going to lead to plaque formation that can, if it's unstable plaque, it can break off, lead to a stroke or a heart attack, and those are the things that we want to prevent.
Yeah. Preventative is the word. Absolutely, you hit it right on the head. So I want to show you another statistic that we've got. So this is the same Fourier study. So when we put our patients on the Repatha, we noticed that there was a 27% reduction in heart attacks after their first heart attack, which is incredible, thanks to the Repatha medicine. And then as far as strokes go, like you said, we want to prevent those too. So strokes and heart attacks are down by over 20% because of the Repatha drug.
Okay.
Does that address your concern? Do you see how, again, this is going to be valuable to your patients?
Yeah, that's really impressive numbers.
The final thing I want to tell you, address is it safe? Well, I'm really proud to share with you that Repatha has been on a formulary since its existence, and I think that really speaks to the product. Not only is it necessary for our patients, but had it not been safe, it wouldn't be on the formulary. So we really pride ourselves on the innovation and science of our biologics, but we also pride ourselves on the fact that other people, other cardiologists and physicians and care management companies are buying into our product as well.
So I'm familiar with the safety profile of Repatha prior to this study. What were the study side effects or the adverse events that were most commonly reported?
That's a great question. Thank you so much for asking. So if I'm hearing you correctly, you were familiar with the safety profile, but you want to know what the exact adverse effects were?
In that particular study.
In this Fourier study, absolutely. So these are the adverse events right here. So this is the statin plus Repatha and then the statin plus placebo. And you can see the breakdown of the different subsets. I think the biggest side effect that we found is maybe irritability at injection site, maybe some soreness, and then also flu-like symptoms are very common in terms of the adverse effects. But if we look right here, again, with comparison to those that were not on Repatha versus, really we're not seeing a tremendous difference.
Got it.
Does that help answer your question?
It does, yeah.
So, Doctor, I can't help but to ask, I mean, we talked about the fact that it's a safe product. We talked about the fact that it could address your patients, that 30% at least, and the other 70% can only see a benefit. And finally, we both decided that it works, right? It's proven to drop those levels of LDL. It's proven to reduce heart attacks. With all that being said, Doctor, I brought some samples along. Can we commit to putting your patients on the Repatha, start lowering their LDLs?
Yeah, actually, I'm comfortable with that. So leave some samples, and some of those high-risk patients, I'll certainly initiate Repatha therapy for.
Sure thing. So I brought plenty of samples here for you. Please give those out to your patients, get it started, get it using it, and what I'll do is I'll give you a follow-up call in about 2 weeks, so not next Tuesday, but the following Tuesday. I'll call you at 9 a.m. I'll see how the product is working for you. If you have any concerns, please let me know. But I mean, we're really excited. I want to thank you for joining me in my mission of helping out our world and the people that are suffering with high LDLs.
Okay,
Thank you
sounds
so
good.
much, Dr. Kraft.
Thank you.
I appreciate your
All right.
time.
Nice job. Love the samples.
Thanks. So, to anyone watching, the only reason I knew where to find those samples is because I am an ag kid and I have to go to Tractor Supply as an ag kid, and that's how I knew they have syringes. So,